Welcome back to Mike's Diabetes World. Current blood sugar is at 6.5. I have done two of these videos fairly close together, so you will see some doubling up of numbers. The pink is basal rate. That's the amount of insulin my body needs to just keep going without eating. Now, the blue lines represents correction, and the pump is trying to get me back in these green areas. So as you see, last night was not as easy of a night as normal. And that's a difficult night. Current time and range is 90, 10% above. Average blood sugar is 8.2, which has gone up 0.1 from before. Very interesting. So, today I want to discuss the topic that if you're a new diabetic or even if you're a current diabetic, there are times you're going to feel like there is so much stuff to learn. Where are you going to go? We're going to discuss that. We'll be right back. This channel is provided for informational purposes only. Contact your physician for any diagnostic or treatment plan. Hemoglobin A1C time and range. How to do the glucometer test. How to give yourself a shot. How to choose the right insulin. How to prepare your body for a shot. White blood sugars. All of these are topics that we all have to learn. Now I know when I was first diagnosed, I didn't really learn that much. I knew I had to give a shot, and that was about it. Now, a lot of you have heard my past videos and saying that 50, 60, I got weeded out by a doctor. I wasn't happy about it. I just decided enough is enough. And I went off of my way, did what I had to do, went to school, ate what I wanted. If I felt like I was getting sick, I'd take a shot. You never learn how to take care of yourself in an environment like that. Now, I had the support of my family, whatever support they could, but it was kind of like, here's the keys to the car. You go, you drive it, whatever. I wasn't ready. Looking back at it right now, I was not ready for that type of responsibility. By the time I went to a private school, I think the nurse kind of saw that, and I was put on seeing a pediatrician, not an endocrinologist. And he started opening my eyes. So yes, control didn't mean it took, and I all of a sudden wanted to do control. But he introduced me to glucometer, and we took it from there. Diabetes education has changed. Personally, what I see now, type 1 diabetes education is more one-on-one with the patient and the diabetes educator. Sometimes you can go to the setting, wherever it is, see your diabetes educator, see your doctor, and even see a dietitian. It's really becoming more one-stop shopping. Classrooms, from personally what I've seen, have been relegated to type 2. I don't know if they feel they can cover more information along that line or not, but that's how it's happening. Now, when you meet with your education person, you need to get your blood work done. Your endocrinologist should give you a requisition. This is my requisition, please. And on it, he will check off items that need to be tested every 6 months. Sometimes, no, it's every 3 months. It was every 3 months. And he will see how your proteins are doing, whole range of things. Because cardiovascular is so important to your well-being. Taking care of the whole diabetic is an important key. We've talked about that in previous videos. Having your body know or having you know what your body will have, what will happen to it is important. Now, there have been people who said, well, every time I go to the doctor or to the diabetes educator, they want to try something different again. And you know what? Yes. Because it's not sort of like, oh well, here you go, now you're fixed. You can go on, live a life full of excitement. You may have multiple issues. They're going to want to work on one area. Once they get that under control, they may want to work on another. That is a concern that you need to bring up with your endocrinologist or even the diabetes educator. And it makes me kind of wonder, Is that an excuse? Or are you really frustrated about it? There is so much that goes into understanding diabetes to teach it that there is a position now called, I believe it's called Certified Diabetes Educator. I could open up a store, put a shingle on the wall, say, Diabetes Educator. Wouldn't mean a thing. Doctors would not send me patients. It's up to our health regions to make sure they have the CDE. So, yes, there's an awful lot to learn. Does it have to be overwhelming? No. I've been an educator, not diabetes, but an educator of adults for many years. And the one thing I learned is digestible chunks. Break any topic you have into smaller chunks. It promotes better understanding. And that's pretty much what a diabetes educator is going to do. If you walk in there and they say, well, here's everything, you go off and do it, it's not going to work that great. Realize that you're going to have so much to learn. Even doing this video, researching, hearing things, when I go to the point and I really ask questions, I've learned even more. Do I think I know everything? Hell no. Diabetics seem to get the basics and think that's it. Well, I'm sorry to tell you, it isn't going to be the basics. You will have more to learn. Keep up with your diabetes, see your diabetes educator. Keep up with your doctor's appointments. Yes, sometimes I will admit it will be a pain, but trust me, you'll want to do it. With that, I hope you have a wonderful day. We'll talk again soon. If you enjoyed the video, please consider subscribing. Thank you. My email is mikesdiabetesworld@gmail.com. mikesdiabetesworld@gmail.com.